Hello everybody. This is the first lecture on evidence-based medicine. It is the introduction to evidence-based medicine. Today we'll talk about the definition or definitions of EBM, evidence-based medicine, and the components of the EBM. It's mainly in English. The quizzes are in English and the exam in English. All the slides in English, but we'll use Arabic when we feel it is needed. I try to convince you it is an important subject to learn. It is an important subject to master. And it should be part of your daily life as a practitioner, a physician practitioner. I will start from the saying of Julius Caesar in the Gallic-War. This is where France and Belgium now, this is the land where the war took place at that time. Our concern about his saying, men are generally ready to believe what they want to believe, and they are generally ready to see what they want to see. What is the importance of this saying in our context of EBM? This saying is indicating to the fact that people are not just whiteboard, they are preoccupied with preconception. They have views, they have belief, and that will affect their judgment in dealing with any subject, any matter in their life, or on reading or writing any article as a consequence of that. So we are, as a human being, have opinions, we have views, and these assumptions will play sometimes a negative role in making our judgment, because we are naturally biased according to our preoccupied views. And if we are talking about a human being, and what about our occupational body, the professions of physicians? It's been always described that we are a group of physicians who are unwilling to change, reluctant to alter our long-standing practice and behavior. And this is what somebody used this term, clinical inertia. And I mean by clinical inertia that this body of physicians not easily they modify their practice. They fail to intensify or to initiate new things. So this is adding to the human being. We are in special firms, we are not very willing to change, and this will add another problem. I will start with history and tell you what's happened a few times in the life of physicians. This is a very known story about Henry Cotton. He was the chief psychiatrist of one of the big hospitals in the United States in the early 19th, in 1915 or to 1933. And he had a belief, as he was preoccupied with the conception that all diseases are results from focal sepsis. And he implemented what he believed in at that time. What he did, that each patient coming to his hospital, he would take 10 teeth from him in the first admission until he would remove all teeth, because he thought and he believed, and he was professor, that this is the source of infection. This is the source of his problem for the patient. He discovered later on that some of the patients he removed all teeth, not cured. So he started to remove tonsils. And then he moved to the stomach, to the colon. He took from few centimeters of the bone to even meters or feet of the colon. And the story went to many years, and actually even his family, he was acting on the same way. So he took teeth of his sons and daughters, his wife, and after many years, somebody had to stop him. But after in that hospital, they lost many patients.